Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. We will start off today with an update on current health headlines, followed by a discussion on workplace injuries, including the aging workforce in Maine and prevention strategies. Our panelists today are Dr. Howard Jones, Medical Director and Consultant Physician, Infection Prevention and Control at Northern Light Work Health. Gregory Bowden, Occupational Health Specialist and Ergonomic Assessment Specialist at Northern Light Work Health. Tammy Colbert, Manager, Benefits and Compensation at Versant Power. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Senior Physician Executive, Incident Command at Northern Light Health. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Health. I'll be your moderator for the next hour. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19 and other current health topics. Dr. Jarvis.
Thank you, Ed. Next slide, please. So I really wanted to go over a couple of things. There's not a whole lot of action going on, but there are certainly some things that always won't play in the media. And the first is that the Maine Department of Health and Human Services requested that the rule in Maine requiring COVID-19 vaccination for healthcare workers be repealed. This decision wasn't just a political one. This was really one based on current science and evidence and in consultation with experts within the Maine CDC and experts across the state of Maine. It's really based on the fact that the interpretation of the rule that was put in place really is not supported by current evidence. And a great example of that is that if a healthcare worker had received a single Johnson & Johnson vaccine in early 2021, they would meet the requirement as it is currently being enforced. But we know now that Johnson & Johnson vaccine is no longer protective against any circulating strains. So to have a requirement that really makes no sense from a science standpoint really is something that we really should be correcting. And that's the reason why that decision was made. I will state that currently this rule is still in place, but should it be repealed, organizations will need to decide for themselves what is best for their patients, staff, providers, and their communities going forward. And I believe most healthcare entities within the state of Maine are actually having internal discussions about what to do about this. This rule does not apply to EMS and paramedic workers. They are covered under a different rule, and my understanding is that will be discussed at their board meeting in August. There certainly are some implications about this repeal, and the biggest one and the biggest concern that I hear both from providers and from patients is what happens if we do have yet another surge of a brand new variant for COVID-19. Would the state consider putting back in a vaccine requirement? And that's unclear as to whether or not that would happen. Typically, the state has been following the federal CDC, and the federal CDC and CMS have repealed their vaccine requirement. But it's important to remember that the federal CDC and CMS do not require any other vaccines, but the state of Maine requires many vaccines for healthcare workers in order to protect our communities. Next slide, please. So where are we at in the current state of the pandemic? And I will say we are still in a pandemic despite recent headlines and other announcements that the pandemic is over. Overall, viral activity remains low in Maine and across most of the United States, but we are seeing some increase in cases and increases in hospitalizations. So we are kind of on an upswing right now. Hopefully that's really just a blip after the July 4th holiday week, because it was more than a weekend this year. But we have been seeing several reports of increased viral elements in wastewater around the country, and that is concerning. I have not seen that specifically stated for Maine, but Maine does not have a robust wastewater testing program as there are in other parts of the country. But it is concerning if we're starting to see more of people shedding viral elements, meaning it's probably in our community. The good news is that in general, healthy individuals with the current strains are having mild or no symptoms whatsoever. But COVID still remains a significant cause of death in the elderly and at-risk populations, like those who have underlying health conditions, particularly heart and lung conditions, diabetes, or being treated for conditions that cause them to be immunocompromised, like individuals with cancer. Most, if not all, of the cases in the United States now represent variants within the XBB family, which that's part of the Omicron family. And it's important for us to know that because we anticipate that any of the vaccines that come out for this fall will target this specific family of XBB, which again is all of the variants pretty much in the United States belong into that family. Next slide, please. There are certainly some other health concerns, and there are plenty other respiratory viruses and GI bugs out there. Particular interest is that there is a new avian flu or an avian flu that has we've seen an increase in birds, and it is concerning that there may be some transmission from birds to human beings. And so recently the Maine CDC put up an alert that if we see people with respiratory illnesses that are consistent with flu and that they have tested negative for COVID, that they would like us to sample those individuals to see if we have seen any transmission of this particular avian flu going from animals to people. Also remember that during summer months, we see a rise in accidents, heat and water related injuries, and the spread of insect-borne diseases, particularly from ticks and mosquitoes. So please remember all the good things. Continue to wash your hands, cover your mouth and nose when coughing and sneezing, stay home when you're not feeling well, wear sunscreen because we can protect it from the #1 cancer, which is skin cancer, stay hydrated and avoid ticks and mosquitoes. And I will say that despite this announcement by Department of Health and Human Services to repeal the vaccine mandate for healthcare workers, it is still a strong recommendation that all of us keep up with our vaccinations against COVID-19 and any other preventable diseases. And with that, I'll turn it back over to you, Ed.
Well, thanks, Jim. I know you're going to return at the end for additional questions, but I got a couple right now for you. So it seems every month I ask you about a new subvariant, and this month is no different. Tell us about EU.1.1, and is this something to worry about?
Yeah, so this again gets back to that confusing alphabet soup nomenclature that we've been confused with during COVID this entire time. And so really this particular strain is really just yet another variant within the XBB family, but they ran out of code numbers for XBB, so it got a new designation, but it is within that family. It does represent an increasing amount of percentage-wise of cases here in the United States. So far, it does not look to be any more transmissible or causing any more severe disease than we've seen with any of the other XBB family members. And so that's good news for us. What it is, though, should give us a pause and caution. One, it reminds us that COVID is still being spread in our communities and around the globe, and that this particular virus is very susceptible to mutations, and that more and more of these mutations can succeed out in the wild, meaning infect human beings. And so it is a cautionary tale. I'll dovetail that to a recent study that came out too that talked about the deer population, and there's pretty consistent evidence now that we've talked about this before on this program, that the deer population also get infected with coronavirus, though they continue to have very little symptoms of that. But there has been transmission from the deer population to the human population. And here in the state of Maine, where we have a very large deer population, it's just one of those things that we have to worry about in the back of our minds that, hey, this is still an ongoing and evolving situation, and we just need to be prepared for changes.
And what you just described as a zoonotic transfer, that's actually fairly common with viruses, right?
That is correct. In fact, you know, influenza often gets transmitted from either pigs or birds into the human population, and there are certainly other viruses that do the same thing.
Okay, so no new surprises there. Okay,
No
good.
new surprises there.
I have another question. Actually, it's got a couple of components to it. So is it looking like late summer for fall, we're going to have another vaccine booster? It's going to be available and recommended. And help us to understand, it's sounding like this may be a monovalent booster compared to what we've been hearing recently over the last, I don't know, 6 months plus of bivalent booster we're currently using. And what about that protein-derived vaccine from Novavax we're hearing a little bit more about now? How's that different compared to the mRNA vaccines from Pfizer and Moderna?
Sure, that is a whole lot. So I'll start
I
off
know, I
first
know.
with part number one. We don't expect any recommendations for influenza for COVID vaccines early on in fall. We expect it October or later, and there's a couple of reasons for that. They haven't quite determined what they want in that particular vaccine. So unfortunately, we will probably be seeing almost a threefold rollout of vaccines for the fall. Initially being against influenza or the flu, then COVID, and then discussions about RSV. You've heard people talk about RSV vaccines for individuals over the age of 65 or who have immunocompromising conditions. So this may be a bad time for both patients and providers in having this rollout when we'd hope that we would have been able to do everything with a one and done kind of mentality. The reason why they're considering switching to a monovalent rather than the bivalent that we've been touting, you're right, it's actually a little over 6 months. It's almost been a year that we've been talking about the bivalent one, is because what I said before, almost all the circulating strains in the United States right now are in the XBB family. And so this particular season for vaccines will target the XBB family. So it'll be a very targeted approach. In terms of what will be available, we expect that both Pfizer and Moderna will have messenger RNA, mRNA vaccines targeting XBB. And then in addition to that, we will have Novavax with a more traditional viral particle vaccine that'll be targeted towards XBB. What we have seen in the past is that the messenger RNA vaccines tend to cause a much more immunogenic response, so meaning our own immune systems turn on a little bit better than we saw with the Johnson & Johnson vaccine or with the Novavax vaccine. But the good news is that for those people who have concerns or have conditions where they can't receive the messenger RNA vaccine, there will be an alternative that's a much more traditional vaccine from Novavax.
Jim, that was awesome. Thanks so much for all that great information. So next, Dr. Jones, Greg, and Tammy will speak with us about strategies for preventing workplace injuries. Dr. Jones, kick it off.
Well, thanks a lot, Ed, and welcome everyone. If you're having trouble hearing me, consider yourself lucky. That was my joke for the presentation. I'm waiting for the uproarious laughter, but you can't laugh back to me. Welcome everyone. Well, I want to talk today about something that's come up more and more in the working population, which is the aging workforce. It's truly an issue in Maine and really around the United States. And I wanted to kind of kick this discussion off by discussing, we'll say, an amalgamated case, but drawn from real experience recently in my life. The story of Bob, and of course, I shamelessly stole from the movie title, so you can hit me with that one as well. I guess my only definition for today is what equals a aging worker. And I guess it depends if you ask my 20-year-old or my 40-year-old what equals old, but I think we all know one when we see one. And as people do get older, obviously their capacities to function change, but they continue, in Maine at least, a lot of times have the same work ethic. And that becomes a blessing and a curse simultaneously. So in the case of Bob, 63-year-old who just won't stop working, I think his employer would probably half the time like him not to be there, because they carry with them their I work all the time and these young whippersnappers just text. But in this particular case, the individual had worked as in the construction trades and had long ago a foot injury that resulted in several surgeries. Finally, when posed with another surgical option, he told the surgeon, just cut my leg off, which, half of you probably in this discussion know somebody like that. And the surgeon obliged, took off the end of his leg, basically. And within about a month, he said, I'm ready to come back to work. He insisted he could work. His employer didn't really know and had probably really thought he was going to go on to retire, but he decided no retirement, at least until he was in his mid-70s. So his employer is faced with the dilemma. What do you do? The employee says, I'm fine. The employer, I'm sure, would like to, wanted to have it back on some level. And of course, therein begins today's discussion. Next slide. So there are several considerations as I was brought into this from the perspective of the employer, all of which in my consultation through Work Health, and again, I was brought in to really establish what can the person do, really considers what his rights are, and he has several rights and the employer responsibilities, as does the employee. The Maine Human Rights Act prohibits discrimination based on race, color, sex, etc. A Whistleblower Protection Act, an employer can't retaliate against someone for exercising their workplace safety and health rights. And this is a variation on that, because he wasn't contending the workplace was unsafe. The question was he safe to be there? He has a right to a safe workplace, a right to raise safety concerns, and a right to report work-related injuries and job hazards. Next slide, please. The workers' compensation law basically state the employee is responsible to report an injury within 60 days. That's on the employee. And again, I'm going all through this because it's relevant to the considerations framing the discussion today. The employer has to complete a first report of injury within 7 days. And obviously an injured worker is entitled to appropriate wage replacement and medical treatment. Next slide. The Bureau of Labor Statistics pretty much sums it up nicely. The unemployment rate in Maine is low, 2.4%. And as we all know in this discussion, some of that is due to people not entering the workforce, as others to the people who actually are employed. And in either event, it adds up to difficulty finding workers. Framing, Bob's situation is a bit of a stressor because, he's an experienced person with decades of experience who just behaves like a person in the 60s, just doesn't want to stop. Maybe he should. We'll get to that in the end. There are about 646,000 total non-farm wage and salary jobs in May. Obviously, more people equals more risk of injuries. And the median age in Maine is 44, or at least was. Comparing that to the national average, also getting older, creeping up there compared to the African continent and South America. It's still higher, but Maine is particularly high. Go ahead and next page. Basically, if you look at the population across the country, it tells the whole story. And in Maine, we are skewed definitely toward older populations. 10,000 people turn 65 every day. And that's growing 5 times faster than the total population over the last 100 years. 79% of baby boomers say they don't plan on fully retiring at 65. And those of you who are nearing retirement age or perhaps even past retirement age know that people are choosing to stay in the workforce needs them, and they have certainly financial incentives with the economy. In 2021, the average age of the labor force was 41, and it's trending upward. And 17% of the labor force will be over 65 by 2025. Next slide. So what are things to really consider in this case? Well, really, the aging workforce is a challenge because people change physically, physiologically, and psychosocially, psychologically, if you will. So start with the physical changes. Go ahead and next slide, please. Those of you who have gotten older, perhaps you even saw the picture of the 90-year-old bodybuilder. He looked great, but he's still 90. And even though he has lots of muscles, he has neither the endurance nor the strength he had when he was 25. So physically, strength decreases, flexibility and balance can be affected. And these may present themselves in those of you who get up in the middle of the night to go to the bathroom and have to hold on to something or have sufficient light to feel comfortable. You can have decreased vision, decreased reaction time and speed, decreased hearing, decreased manual dexterity and feedback, and decreased body fat. I'm waiting for that part personally. I think when I'm 147, I'll be normal body fat. Until that time, I do notice that, what I think I've lost physically, perhaps I've made up for an experience. So physiologically, things change that may be less apparent to me in my day-to-day life as a person getting older. My oxygen intake decreases. My blood pressure definitely goes up as our blood vessels become more stiff. We fatigue more quickly, as I'd mentioned. Endurance, I think everyone on the Zoom meeting today would recognize as they get older, endurance decreases. And you have greater susceptibility to extremes of temperature, which we in Maine, particularly this year, enjoy. Next slide. So psychosocially is probably the biggest issues. Just pointing at myself and picking on me, my shift preferences from, frankly, when I was younger, not minding working nights, have changed to this point. Nighttime probably begins time around 9 o'clock if I'm being generous with myself. I have different training and learning styles, and I fall back a lot on I already know that as an excuse for why I don't want to learn things, or I try and impose, as the case of Bob, my way on my employer, even if it's not the best way. And it took me years of therapy to get to be able to say that, by the way. And we can tend to feel disengaged with work and coworkers, except I'd have to say my coworkers are tending to be as old or older than I. But the younger coworkers, I just don't understand why they have to text all the time. And I'm not really sure how you text on my phone. And I hear that so much from older workers. As a point of pride, I'd have to say. Let's go on to the next slide. So I want to bring in one of the issues really to consider, to my colleague and friend, Greg Bowden, is here to take the next set of slides. Again, we'll be around to answer questions at the end of all this. Greg, take it away.
Thanks, Dr. Jones. So although the characteristics of aging workers that Dr. Jones just mentioned may put them at a higher risk of injury, they have more experience and are statistically less likely to have workplace accidents. While it's true that we all experience physical and cognitive changes as we age, experience often helps the older worker compensate for loss of ability, so they are a valuable part of the workforce. If an older worker gets hurt, it takes them longer to recover, which is a problem. The solution? Improve workplace design with proper ergonomics. So what does it mean to be ergonomic? You hear it all the time with products describing themselves as being ergonomic, which typically means they're designed to be more comfortable and easier to use. Well, this may be true, but depending on the product, the buyer should be aware that this term gets thrown around as a selling point. Human factors and ergonomics are all around us. Anytime you've engineered a product, process, or system to work more effectively with humans, you practice ergonomics. Ergonomics means fitting the job to the worker instead of the worker trying to fit themselves into the job. We're all different shapes and sizes, so what may work for one person doesn't necessarily work for another. We can accommodate aging workers by being aware of their capabilities and limitations and work towards fitting the job and task to them. Ergonomics should follow a continuous improvement process to reduce the risk of injury. Initiatives in ergonomics, well-being, and health are economically beneficial investment and something that businesses should prioritize. They should start by looking at their OSHA 300 logs to see what their injury data is telling them. Prioritize the jobs for evaluation and conduct ergonomic evaluations, preferably before an injury occurs. The evaluation should have a list of recommendations, and a team approach is used by working with management to develop the best solution. Once that solution is approved, then it would be implemented and then evaluated for effectiveness. Good ergonomics is good economics because study after study has shown fewer injuries, better productivity, increased savings, and improved employee morale, just to name a few. Next slide. To get a better idea of how this all works, I'd like to review 4 control methods that can be used to reduce ergonomic hazards. There's engineering controls, administrative controls, use of PPE, and last but not least, use of someone like me, an occupational health specialist, to implement early intervention for your employees. Next slide, please. The basic concept of engineering controls is that to the extent possible, the work environment and job itself should be designed to eliminate hazards or reduce exposure to them. This is the preferred method and often achieved through equipment design or redesign of workstations or tools. Adjustable features are preferred so that the job or task can be designed to fit the person. Having a good office chair is an example. For the office worker, a chair with adjustable features is one of the most important pieces of equipment because of the amount of time that's spent sitting in them. They should be supportive of the lower back and adjusted in a way that allows for proper positioning when using the keyboard and mouse. Office ball chairs have been a fad, and studies have shown that they're a bad idea to use in the workplace, and maybe this is why. So this isn't an office ball, but these are beanbag chairs, and obviously this is meant to be comical. The video isn't playing, but you can see that these beanbags are not a proper height, and they really don't lack very many adjustable features. Although they are comfortable to use at home, they can be a trip hazard. So yeah, please everybody have a nice adjustable office chair. Next slide. There are times when engineering controls are prohibitive, so adjustments may need to be made to the company procedure in order to minimize the worker's exposure to the risk factors. Administrative controls reduce the employee's exposure through methods such as education and training, job rotation or enlargement, work reduction or modified rest breaks, work conditioning, and providing additional staff if possible. This category of control relies on compliance from the worker and management and does not offer permanent solutions to controlling hazards in the workplace. Personal protective equipment, or PPE, is the least effective control and includes clothing and devices to protect workers. PPE needs constant effort and attention from workers, including proper use and training. Workers must use it correctly, and they're often uncomfortable or cumbersome. They have to be fitted perfectly and maintained correctly, so PPE is hardly a fail-safe, but sometimes it's just the best that you can do. Examples are gloves, safety glasses, hearing protection, hard hats, and respirators. An occupational health specialist is someone who helps analyze and collects data on work environments and procedures to ensure workplace safety for employees. Prevention is key and can save the company a lot of money down the road by ensuring proper ergonomics and body mechanics for new hires and existing employees. Work readiness is a set of skills that are necessary for any job and often depend on the interaction between the employee and their environment. If the employee starts to develop an ache or a pain, then it's important to act on that early before it progresses into an injury, resulting in lost time at work. Work health contracts with companies like Versant Power, who utilize OHS services and have locations all over the state. I travel to those locations monthly if necessary to meet with their employees who have had any kind of an ache or pain, whether it's work-related or not. If it is work-related, the employee might need to go directly to a work health clinic depending on the severity of the injury. If it's not too severe, then I can show them how to best manage their symptoms through education, stretching, and exercise. If the employee develops an ache or pain outside of work, I can see them as well to help manage their symptoms and speed up the recovery time. It is important to recognize that any injury process can impact the employee's performance at work, so staying on top of it typically results in a long-term savings for the company. Next slide, please. Your posture provides a good starting point for evaluating the tasks that you do. The best positions to work in are those that keep the body in a neutral position. The neutral position for your arms is to keep your elbows at your sides, your shoulders relaxed, and your wrists straight, especially during computer use. Make sure you sit all the way back in your seat and keep your head straight to maintain the proper curves of your neck and the small of your back. When standing, putting one foot up on a footrest or stool helps keep your spine in proper alignment. Stand with your feet apart to create a sturdy foundation, bend at your knees instead of your waist, and avoid twisting and bending at the same time. Whenever possible, try working from the power zone or comfort zone. The power zone is the space between your mid-thigh and mid-chest, which is where you can lift the most with the least amount of exertion. When your body is in a position outside of the power zone for a long period of time, the smaller muscles in your body are forced to work harder than they are designed to and provide less support than what is needed. And this is when injuries occur. A good rule of thumb is that most work should be done at about elbow height, whether you're sitting or standing. There are a few exceptions to this rule, however. Heavier work is often best done a few to 4 inches below elbow level or around waist height if you're standing. Precision work or visually intense work is often done a few to 4 inches above elbow level to make it easier to see. Power grips are the strongest amongst all the different grips that can be made by humans. Fingers flex to clench an object, and forces generated by muscles hold the object firmly to keep it in contact with the palm. They're not like precision grips where force is applied between the fingertips and usually involves the manipulation of an object. So a power grip, so just to demonstrate, if you make an OK sign with your wrist straight and you put your other finger in there and try to pull it through, you'll see that there's a fair amount of resistance because that's where your power is. If you flex your wrist all the way, then you'll notice that your finger will drop right through. Again, you're just using the mechanical advantage of a power grip. Tools can be used to change the grip from precision to power, and I noticed a good example of this when I was in line for a drink at a concert. There was a policy where all drinks need to be opened when they serve them. So this meant the workers needed to repetitively unscrew a cap or pop the top off a can. And I saw one shaking out her fingers looking like she was in pain. They're inexpensive and adjustable bottle openers. They have them, you can buy. They unscrew the cap with a power grip, which uses strength and leverage. And there's even an attachment that pops off a can. So these employees just needed a tool. They range in price from $5 to $10, which is a drop in the bucket compared to rehabbing an injury. Next slide, please. Studies have shown that sitting for long periods of time is linked to a number of health problems, including obesity, type 2 diabetes, and heart disease. Our bodies are made for movement. Adding movement into the workday promotes blood flow and can improve your metabolism. Increased movement can lead to improvement in motor function, attention, and even cognitive speed, all of which have the potential to impact work performance. From boosting energy levels and improving conversation to strengthening muscles and reducing stress, moving more during the day can have a huge impact on both your physical and mental well-being. For computer users, I recommend a 30-second standing stretch break for every 30 minutes of seated computer use, or at least twice an hour. How many people do that, right? Some people will use a timer on their smartphone or watch as a reminder, and there are many apps that can be helpful to track your activity level. Pre-shift stretching and warm-up exercises have been proven to reduce the risk of injury and can serve as a real morale booster. Poor lighting is a common problem in the workplace that can affect a worker's comfort level and performance. The level of lighting that a worker needs varies depending on the nature of the task, the sharpness of the worker's eyesight, which can be influenced by age, and the environment in which the work is done. As a rule, generalized lighting should be distributed evenly throughout the workplace without gaps so that workers can comfortably see and move without straining their eyes. Providing workers with adjustable task lighting is often the simple solution to lighting problems. At a computer workstation, take steps to control screen glare and make sure that the monitor is not placed in front of a window or a bright background. Inadequate light can cause stress, fatigue, headaches, eye strain, and possibly accidents. Too much light might cause glare-induced headaches and contribute to employee stress. And for my last slide, before I turn it over to Tammy, please support a culture of safety. It's important for the employees to know about the hazards that they may be exposed to and that they're trained on how to protect themselves. Safety is a team effort, so it is important for the employee to be trained Investigate all accidents, injuries, and illnesses and close calls as they occur and document all of your safety efforts. The employee may or may not always tell you about these things for fear that they might get in trouble. So be clear with them from the beginning that they will not. Now more than ever, human resources or HR departments play a critical role in the success of today's organizations. And now I'd like to turn it over to Tammy, who manages benefits and compensation for Versant Power, to tell you more about that. Tammy?
Thanks, Greg. So I'm here this morning to give you some human resources perspective and specifically about our population at Versant Power and how we approach our culture of safety. So some of the unique challenges that we have, 32% of our employees are in what I would consider a high safety risk or in a physical labor position. So not to say that our office employees aren't also at risk, but obviously our linemen are looking at power every day, working with it in that potential for electric shocks if they're not using the appropriate PPE, if their mind isn't on task. And on top of that, our employees drive millions of miles every day, every year, sorry. So that puts them at risk for motor vehicle accidents and related injuries. Ergonomic and soft tissue injuries are our top categories for both our field employees as well as our office employees. Secondary to that is slips, trips, and falls. Dr. Jones had given us some statewide data. Our average employee is actually greater than the statewide average, and it is 47 years old. We also have approximately 25% of our workforce is nearing retirement in the next 5 years. The other challenge that we have is our workforce is located anywhere from Fort Kent to the Bangor area. So as preventative measures, Versant is committed to offering ergonomic assessments. That actually happens during our new hire orientation. We have an intranet where employees can go ahead and put in a request for an ergonomic assessment. And a lot of the time, especially in the Bangor area, Greg assists us with getting those ergonomic assessments done. So we feel strongly that if we set them up with the right ergonomics at the beginning, hopefully it will lead to less likelihood of an injury. We also work with Greg with his occupational health specialist services. He schedules a time to go to each of our locations, even to Fort Kent if there's a need. So he has face-to-face time with all our employees so that they know that we do have that culture, that we care for them regardless of what location they're in the state of Maine. We have an extremely strong safety culture. We have an excellent safety team, and daily they are out, whether doing investigations or safety observations, working with our employees about different ways to do their job safely. Everything, every day at Versant Power, the #1 goal is everybody is safe and goes home safe at the end of the day. Every employee must attend a company-wide safety meeting. So every single employee, at least once a month, is in a safety meeting with a different safety topics that we discuss each month that are relevant to the time. We also set aside 3 to 5 days annually where every employee is required to attend our safety days. Again, we have professionals come in with different safety-related topics to our different groups of employees, and those times are dedicated just to talk about safety. It doesn't matter if we're having an HR team meeting or if our executive leadership team is having a budget meeting. Every single meeting at Versant Power starts with some type of relevant safety moment. So just yesterday, we had our monthly safety meeting, and we were told about things to look out for to make sure that your tires on your personal vehicle are in good condition, what to look out for, how to check the pressure of your tires, and to look for abnormal wear and tear. So those are the different types of things that we do. So literally every day, there's obviously plenty of meetings, and at every meeting, we make sure that we talk about safety topics. One of the tools that I'd like to use within human resources, and some people say, well, this is ADA and get scared about going through this process. Every employee that I've been through the ADA process with, it's been a great interaction between the employer and the employee. They feel understood about what accommodation that they're asking for, and they feel like they have input into the solution that we come up with. And then we make a determination of whether that is a reasonable accommodation and if we can, in fact, go ahead and do that. So this process starts out, there's really 2 types of processes here. The first easier type of process is if we receive any medical documentation, whether that's an M1 from a work-related injury, or their personal physician has provided us a return to work note with restrictions. We simply take that, we talk to the supervisor about whether they have any concerns about the employee coming back under restrictions, whether they can appropriately still fulfill their duties, and number 1, whether they can continue to do it safely within the restrictions. 90% of the time, we are able to accommodate our employees because I believe the quicker that we can re-engage employees back into the workforce, the better that you have for retaining them and for them being engaged as an employee. So in those cases, once we're sure that we're able to accommodate, the employee returns to work. And then at the point, we either check that they've been released to full duty, or as their restrictions lift, we reevaluate every time and make sure that we can safely return them to work. Now, there are those times when it really is some type of disability when an employee is looking for an accommodation. So we have the employee fill out a request for accommodation. They really need to give us a lot of insight. What are they requesting for an accommodation? Do they have any suggestions about what we can provide that can make the environment better for them? We also require a physician statement, just so we can ensure that the employee is aware, and it's great to have a physician give us information and additional information about what they've seen before that's been a reasonable accommodation. Once we have that information together, we have a very interactive process and sit down with the employee and discuss what are the types of things that we may be able to do. Again, for the most part, or in the 3 years that I've been with Versant, we've been able to come up with solutions that do provide a reasonable accommodation. And the employee feels really good that they were involved in that process. So we do partner with Northern Light in quite a few ways. So just want to give Greg another shameless plug. He is really integral to our safety culture. So his monthly visits to each of the locations as needed. He meets with employees on a preventative basis, whether it be about a work-related condition or their own personal condition, which again, at some point, could turn into a work-related injury. He also assists me every time I get an injury report. Most of the time, he's able to interact with the employee, give them some stretches, whether heat or ice is appropriate. So that keeps that type of treatment as first aid, which keeps that injury from being a recordable injury. And everybody would like to have great safety stats. So as much as possible, if we can avoid a recordable injury with OSHA, it's normally because Greg has intervened. So for our preferred workers' comp providers, we work with Dr. Jones at all his locations throughout the state and his other colleagues. It's great when your workers' comp provider is familiar with the jobs and the physical requirements within your company. So as much as possible, we do use Work Health because they are very versed in what our requirements are for people working in the office, or for what our linemen are capable of, or maybe our fleet mechanic. So it really helps us to reduce lost time injuries, the number of restricted days, and they already have a perspective on what our employees can do safely when returning to work. And then the other services that we use this is all about the full employee experience. We work with Northern Light Workforce, and they are our employee assistance program provider. And we just changed at the beginning of the year so that we would have people in Maine picking up the phone when our employees needed assistance. So it's completely confidential. An employee can feel free to reach out about work, health, or life concerns. And they can also interact with the other parts within Northern Light. Maybe an employee is concerned about their work-related injury, but didn't feel comfortable talking to us. Well, Workforce EAP can reach out to Greg and tell him about this, and then we can do some interaction with the employee to make them feel more comfortable. Later this year, talking about the whole wellness of our employees, with Northern Light Wellness, we are going to be rolling out biometric screenings. Again, we're going to be all the way up to Fort Kent and down to the Bangor-Hamden area to make sure all our employees are included in this service that we're going to provide to them. And then as a follow-up to that is health coaching. So again, providing all these services to our employees. Our older employees obviously probably need a little bit more support in their personal health. That'll help improve attendance, longevity, staying with the employer. So we're really looking at a full employee experience. And now I will hand it back off to Dr. Jones, and he's going to do a bit of a follow-up about our test case of Bob.
Thanks a lot. I appreciate it. Try that again. Everyone can actually see my smiling face. There I am. Thanks again. As you might imagine, those of you in the studio audience, this particular employee continued to insist that he was able to do his regular job, and he really wanted, we'll say, unrestrictions. And the question was a little reversed for today's topic, in that the question was, what could he safely do? Him contending he could do everything. So to Tammy's point, with a shameless plug of myself, the skilled and always sharply dressed occupational health provider met with the employee and the employer, and I did what a good occupational health provider should do: try and get an understanding of what the job is by actually going out to the job site. All of our providers within the Work Health Network make regular visits to, we'll say, shops to see what people actually do. So, and I would admit, going and touring a plant or watching someone do a job for an hour or two is not the same as doing it 8 hours a day or 10 hours a day for a lifetime. But it also gives you a certain amount of credibility in the eyes of the employee. Did a worksite evaluation, which in this case was literally at the worksite, a heavy equipment situation, and basically put Bob through his paces with the presence of a supervisor, someone who actually understood exactly what the job was. Watched for a couple of hours. He did his thing. And in fact, frankly, as I'd mentioned, he'd had an amputation done. The coworker said he seemed to be better than he was before the amputation. He admitted afterwards over coffee that maybe he still needed a little time to adjust himself and acclimate to his prosthetic, but that he was doing better. So a couple of weeks ago, I'd actually called talking to the employer on another topic, and sure enough, he still goes to work, he does his job, and he basically said to me, and I'm sure would say it again, he's going to keep doing his job until he's good and ready to stop. I might have cleaned that phrase up a little bit. So there you go. Again, trying to take this conversation in a somewhat different direction than what is a discussion of just injuries, to look at the aging workforce, the pros and the complications. I'll turn it back to Ed.
Well, thanks, Howard. We appreciate that. And now we'll have all of our panelists join for questions. I'm going to start us off with a question that Dr. Jarvis has answered by typing. I want to make sure that everybody's aware of this. So David asks, I understand that malaria has shown up in the US. What concern is there from the CDC that this will spread aggressively throughout the states and Maine? And Dr. Jarvis responded by pointing out that it really is a great question, really kind of cutting edge information out there. So as it stands right now, there's little risk in Maine due to our current climate. Mosquitoes that carry and transmit malaria live in very hot, humid climates, and continuously humid is important for them as well. Unfortunately, those conditions are now being seen in southern US. I would say you're hearing a lot of traction for mosquito control and prevention of diseases, and keeping in mind malaria is not the only bad actor that mosquitoes can promote, including some in Maine. We'll keep an eye on this malaria, and Dr. Jarvis will give an update as appropriate over the coming months. So thanks for that question. The next questions are Greg, probably most suited for you.
Okay.
Let me just read one here. This one is focusing on chairs, both in the office and at home. There have been incidents with falls from chairs. These can be serious injuries that can alter an employee's life at work and at home. Chairs and office equipment for remote and in-office employees has become more of a challenge. Is there a website or are there recommendations for managers and supervisors to assist employees with correct and safe equipment? And a couple of quick follow-up questions you could roll right into your answer. For example, should chairs be static without wheels? How can we better educate our employees on the settings of these chairs to prevent injury? So a lot of questions rolled up into one, but take it away, Greg.
Yeah, excellent question. Chairs should have wheels. In order to enter and exit a workspace, you're going to want to have some wheels on your chairs. Now, of course, there is a risk. Anything that has wheels on it, you could fall out of. I would mitigate those by having armrests on the chair, and make sure the employee is reaching back and holding on to the armrest as they sit down and stand up. We teach that a lot. I was an occupational therapist. I still am occupational therapist for 27 years. So just getting back to the basics of knowing how to sit and stand, and then also paying attention. That's the other thing. As far as home goes and resources for that, chairs, there's just so many different kinds of chairs out there. I would consider myself an expert in knowing how to adjust them. A lot of people are not. So familiarize yourself with the adjustable features, or if you're going to purchase a chair, make sure it does have adjustable features. I like to, if you only see one lever on the bottom of the seat, then it's probably just going to go up and down, and that doesn't really provide proper lumbar support or seat depth or armrest height, if it even has armrest. So, asking someone like me to come do an assessment would be helpful in knowing if the chair that you're using is a proper one. And I do offer virtual assessments for home-based employees. It's actually been very effective because I've been able to do evaluations with people outside the state of Maine even, and help them fairly significantly. So yeah, I hope that answers the question.
Yeah, great, Greg. A quick follow-up question. I'll point out that you made it clear that you're not in favor of beanbag chairs, but what about kneeling chairs?
So there's a lot of what I call a fad on the market. Kneeling chairs, the idea for that is to kind of force lumbar extension because it's hard to slouch in a kneeling chair, just like it's hard to slouch when you're sitting on a ball. However, again, that's forcing your body into a position that isn't necessary for office work, say. If you want to use a kneeling chair at home while you're watching TV, first of all, I'd be surprised. And then I would ask, well, why do you think it's better to do it at a computer? If you're having back pain, I would suggest a sit-stand workstation in a chair that actually provides lumbar support so that you can relax the muscles of the lumbar spine instead of trying to overwork them.
Great. Well, thanks for that.
Sure.
Another question that seems to have a typed response: how to handle at-home workers that set up their own workstations with limited oversight on Ergo? Any suggestions about this? And there was a typed response, Greg, I'm thinking it might have been from you, to set up a Zoom meeting. So maybe you could build off of that.
Sure, yeah. Recently, in fact, January of this year, I really started rolling out home. I wanted to look at the remote workforce because it has been a couple of years since a lot of people transitioned to work from home with the pandemic. And a lot of them went home with very little understanding of how they were supposed to set themselves up. So I do offer virtual Ergo assessments and actually in-person home Ergo assessments for those that live generally within an hour radius of Bangor. So the best way to schedule one of those would be through our email address, which is workhealthergo, all one word, @northernlight.org. Happy to have you email me directly if you'd like to at gbowden@northernlight.org. Either way, I'll handle the request.
Well, that answers the next question in the lineup too, Greg.
Oh.
That's awesome. Thanks so much.
Yeah.
Okay. Let's see our next question. So, Dr. Jones, this question's for you. So, how does an employer avoid physical disability discrimination if the work requires abilities the worker no longer has? I mean, there seems to be that conflict, that tension or struggle, if you will.
It is, and honestly, to that point, that's a probably growing piece of my professional life now, and it extends beyond just the the mythical, not really mythical, the actual person working that I discussed in the beginning of this, Bob, and extends even to people who may be having cognitive decline, perhaps from medical illnesses. Doctors, engineers. It's been strange how that sort of ballooned. in my fantasy life, everyone has a adequate job description that describes what they really have to do. But translating that into a person's performance is challenging. And as I tell, frankly, patients, if they have medical concerns about their capacity to work, they need to bring them to the surface and float them. Otherwise, an employer has no option, if they can't perform the job by whatever criteria the employer's got, to work with a person toward, frankly, terminating them on the basis of performance. If it's a medical issue, it begins probably with an honest conversation. I have more and more cases now where employers call our office and ask me to actually see someone. I sit with a copy of the letter, usually from Human Resources, describing the concern and have the first conversation with the employee. And obviously, employees generally acknowledge that the job descriptions that I receive as part of this are pretty accurate. But then where you really get in the negotiation part is having the complicated conversation about what their medical condition really implies. And I would say, as much as I joked about Bob going back to work, I had to keep him out of work another month just to allow him really to fit in his prosthesis appropriately. So probably the best thing to do is, with an occupational physician, schedule a fitness for duty evaluation. There's a bit of a process to follow so as not to be perceived as discriminating. And I think, as Tammy would agree, to make it seem more comfortable for everyone involved as to why you're asking the question and what outcomes might occur.
Great. Well, thank you. Tammy, this question's for you. And I'm trying to dig down into the culture of safety concept a little bit more. So tell us a bit more about how Versant came to embrace a culture of safety. And what I'm not looking for is the checklist items of what to do, but more of like, this is a great idea and leadership is completely behind it, and this is how we become committed to a culture of safety. So tell us about how that came to be.
Yeah, if you think from just a business perspective, workplace injuries can be rather costly. So not to say that, we don't want all our employees to be safe and have a great experience. There is a dollar figure to how you look at safety. And there's also the employee engagement part of that. And I think the more people that keep their mind to task, and a lot of our injuries is somebody was distracted or they didn't think about what they were going to do before they did it. So the constant reminder is part of our prevention strategy. In people, we kind of sit around the meeting sometimes and, we're killing ourselves trying to come up with a safety message for an HR meeting. And when you really start thinking about it, safety is in everyday life. Like, this isn't just about work. This is about when you're driving to work. This is when you're taking your kid to school and the school bus is stopped and you have to pay attention to make sure everybody's safe. So it's even not just a workplace thing, but I think for most companies, a strong safety culture stems from knowing what the consequences are of not having a safety culture, and whether that's the cost to the employer or, unfortunately, a cost of an employee's life.
Mm-hmm. And then those costs that you talk about, we only have about 30 seconds for this answer,
Yeah.
but those costs, are there like benchmarks that you can pull together and like understand those costs?
So it's really based on your usage of workers' compensation.
Oh,
So
I
again,
see.
when we talk about using Greg in a preventative basis or having an injury not go to the next level that needs, an orthopedic consult or, a surgery, it's really based on your experience and how you use your workers' comp insurance that determines your rate for the next year. So
Yeah,
you could have
so
a
a lot
really
of
bad year. Yep. In the subsequent year, you do great. And then you would expect your rate for workers' comp insurance to reduce.
so the workers' comp claims are a wealth of information. Great.
Yeah.
Well, thanks, Tammy. So we've reached the end of our scheduled time. Darn it. We have included resources for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists for such useful information. I hope this hour will help you to successfully manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on August 17th. Our topic will be youth substance use and addiction. As business owners, managers, and parents, this topic certainly deserves our time. There's so much that needs to get done in this space that I hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon.
Thanks.
Thank you.